A failing grade for safety at the region's largest healthcare facility has officials there pushing back, hoping to reassure tens of thousands of people who rely on them for emergency care, surgeries, and all kinds of specialty services. Huntsville Hospital recently received an alarming failing grade for safety practices in a semi-annual report from the Leapfrog Group. The 353-page survey, the Leapfrog Hospital Safety Grade, offered a scathing review of the hospital's daily practices. But Huntsville Hospital calls it unfounded and unfair to hardworking hospital staff. The review applied letter grades across 32 different categories, along with an overall grade for each of the rated facilities. Huntsville Hospital received an F, even though it notes that it didn't participate in 3 of the study's measures. Fox 54's Caleb Aguayo investigates.
Huntsville Hospital under fire after a failing review of its safety practices, but the report did say the hospital's decision not to provide certain information factored into that grade. Huntsville Hospital responded in a statement to Fox 54 saying, "The Leapfrog survey is not an accurate measure of patient safety at Huntsville Hospital. This process is unfair to the thousands of dedicated clinicians working around the clock to care for the community and respond to emergencies anytime they are called." They added, Huntsville Hospital takes care of the sickest patients in North Alabama and Southern Tennessee, noting that the review's mortality rating failed to account for patient transfers from other hospitals. With Huntsville Hospital's newest safety rating from the Leapfrog Group, things at first glance aren't looking so great. They scored highly on communication practices, but scored average or subpar on many of the safety measures involving harmful events. They declined to report on effective leadership, staff cooperation, and bedside care for patients. Thrive Alabama's CEO, Mary Elizabeth Moore, says patient safety in any medical setting is critical, regardless of what you're there to do.
There are so many protocols that are in place, and those are there for a reason. It's extremely important to make sure that you are following protocols at all times with sharps, with any equipment that you're using, and then again with talking with the patient and treating them in a respectable manner.
Moore also notes that many of the safety hazards can be things you don't even notice.
Making sure that you have a clean environment because, of course, germs can form, but there are safety hazards, things in the hallway that you don't think about, and you never know, what little things are going to happen.
Huntsville Hospital says it will provide the Leapfrog Group with more data in its next study, telling us it's a drain on resources, but something officials concede they feel they now need to do. In Huntsville, I'm Caleb Aguayo, Fox 54 News.
The hospital scored better than average on one item for not leaving objects in a patient's body after surgery. It rated average in 12 of the 32 categories and worse than average in 16 of them. Those include certain types of infections, hand washing, patient falls and other injuries, and death from treatable serious complications.